So, well, so schizophrenia is a mental illness manifested by the patient has disorganized thoughts, delusions, illusions. So basically there's thought disorder. In plain English, the person is unable to differentiate between reality and fantasy, or reality and something out of this world. Sometimes they think that people are after them, people trying to kill them, poison them, the FBI is after them, the CIA is after them. They might hear voices, they might see things. It's very important, however, that you rule out drugs in the system, because methamphetamine causes exactly the same symptoms. Marijuana causes exactly the same symptoms, especially marijuana that is genetically engineered nowadays. Different kinds of marijuana. There's some of them, they're very much they cause psychoactive. It has psychoactive ingredients, can cause paranoia. So cocaine can cause that. Drugs in general, mushroom, what have you, even ecstasy. So people can become psychotic from drugs, and that's actually the most common reason for psychosis in the United States and around the world. Again, contrary to common belief. Schizophrenia actually is very, very rare. They say it's 1%. I say it's way less than that. Way less than that. They said it was 1%. That was probably 50 years ago, but the books never changed. And so I would say it's much less than that. The real schizophrenia, the organic, or I should say the actual schizophrenia that is not related to drugs or medical conditions, is very rare. It's way less than 1%. So you have to rule out these things by doing lab works on the patient. And again, schizophrenia is almost never manifested after the age of 20. So if the patient is reached the age of 20 or 22 maximum and they're normal, they're never going to be schizophrenic after that. Again, that's also contrary to common belief, thinking that you're 30 years old and all of a sudden you become schizophrenic. That is nonsense. So usually if somebody has schizophrenia, it manifested by age 14, 15, in high school. They start to act weird, and the family have to pay attention and get them some help. So again, the schizophrenia is a thought disorder, basically. It's rare, but it's not uncommon. It can happen. It happens on a young age, like I said, usually school age. The family might not notice it, or they might thinking, oh, this guy's a teenager, or he starts acting weird because he's a teenager. I would say if the teenager starts acting weird, it's not because he's a teenager. You're going to have to investigate. Like if they isolate themselves all of a sudden and they don't want to talk to anybody, they isolate themselves from their friends, from their family. This is a red flag. Okay? This should raise a red flag. What else? It's treatable, of course. We start the patient on antipsychotics, and most of the times they do work. They help. But again, I have a different theory on the treatment of schizophrenia. But I don't want to go into that right now. But in general, usually psychiatrists give antipsychotics for the treatment of schizophrenia.